I always like to start these with really hard thinking questions that really,
Good.
really set the tone for our time together. So I'm going to do that.
Okay.
When you wake up in the morning, what are the first 3 apps you use on your phone?
Oh, that's embarrassing.
No way, come on.
First one is my banking app.
Yep. Facts.
It's not unusual, I'm sure.
Same, yep.
Second one is Outlook, unfortunately.
Yep.
And then the third one is usually something social.
Yeah.
Yeah.
What's your social platform of choice?
You can go down a deep rabbit hole in TikTok.
Yes, you
Yes.
can. Yeah. I've been using Twitter since like 2008, I think. And so I find if I get onto Twitter, I'll get like some news or whatever, some brain slop as well. But if I get onto TikTok in the morning, I can burn 20, 30 minutes
Easy.
without looking up.
Easy.
Oh, that's right. I got to do something today.
Right.
So,
My problem with Facebook is that I'm part of so many business and audiology professional groups that it's not relaxing.
No. Yeah, I could see that. Yeah,
I end
could
up
see
like
that.
screenshotting a bunch of things and starting my list for the day, which is probably not a bad idea, but
That's true. Yeah, that's true. Okay, so talk to me about starting your business. What year did you start your business?
2017,
Do you remember the month?
June
June.
23rd.
June 23rd. She knows it. Talk to me about July 2017. What was that like? What were your emotions then? How did you feel?
So for me, it was a little bit different.
Okay.
My business was started under an umbrella corporation.
Okay.
So it was under a partnership.
Okay.
And their goal was to teach me how to run a business.
Oh, okay.
So it wasn't as stressful for me. I mean, it still was daunting, but I had a lot of hand-holding for
some support
a couple of
there.
years. Yeah.
Wow.
And so that was not too bad for me.
Yeah.
So the stress that a lot of entrepreneurs have starting their business, I kind of didn't really have
That's
until
cool.
later on.
Okay.
When I bought the business out from under the partnership in 2020, January of 2020.
Oh, 1 month before. Okay. Wow.
So super excited.
Yeah, and then
and then COVID. Right.
So
I was on my own completely in 2020.
What were your thoughts when we don't often talk about COVID as much. It's been 5 years, but February, March, you're on your own. COVID's happening. How was that impacting your business?
In a lot of ways, we're such a face-to-face company in business and working with an older population who, they feel some little ripple in the news and everything stops.
Shut down. Yeah.
Right. They get very, very anxious.
Of course.
So political climate, COVID, all that affects us very deeply.
Yeah.
So my office manager and I were the only ones working at the time. And so we kind of divided up the days. We weren't in the office on the same days.
Interesting, yeah.
I only had Lakewood Ranch at the time. So we didn't want to run the risk of one of us infecting the other person and then having to shut down completely. So we alternated days. We did a lot of like parking lot consultations.
Yeah, okay, yeah.
We just, we were just small enough. We could just shift really quickly and easily.
Yeah, smart. For us, we had the initial scare, right? Like oh my gosh, how's commerce gonna happen? But we have a hybrid work model here, and so we were already in a position where, like, I'm an office guy. I got to come into the office every day, but we were already accustomed to working from home and things like that, using Zoom, using different softwares to communicate. So we didn't miss a beat, right? We just kind of kept going. And there was no traffic on the road when I was driving.
Yeah, no, it was pretty great, wasn't it?
The office. Yeah, like, oh, great, I can get there in 15 minutes, great.
Yeah.
But scary time, certainly scary time.
Yeah.
And so that you only had one office at the time, now 2. Why did you make the decision to get a second office?
So a lot of the business decisions I've made, were just kind of opportunities that I've been very lucky in that way. Certain opportunities presented themselves. And one of the other businesses in the building that we were in was opening up his second location and offered me space.
Interesting.
And I thought, what's you know, it was just an
Why
office in the
not?
back of a physical therapy clinic. You know, I
Right.
appreciate the opportunity. The rent was the right price.
Yeah.
That we'll give it a try, see how it goes.
That's cool.
Yeah, yeah.
That speaks to this, you know, when opportunity knocks. I know that's like an old school saying, but like,
You got to take a couple of risks.
yeah,
You know, there wasn't a lot of risk involved, but it was still a commitment.
it's still a risk.
Yeah,
Yeah.
yeah.
But it's a good part of town. You know, you've got the one in Lakewood Ranch, and then now West Bradenton's been open for a few years. That's a really good part of town, especially for the audience that you're serving.
And we found when we moved from that when we realized that, and I felt the need was there. I'd already kind of worked on that side of town before the business. So I knew that the opportunity was there. I knew the opportunity was there for our business model versus some of the other business models that are in town.
Yeah.
And so we decided to move the clinic into our own space.
Nice.
And when we did that and we had our own front door, we got lots of feedback back from the patients. Oh, this is so much better. This is so comfortable. We really like this. It just kind of elevated a little bit, and they really liked how that little clinic felt.
I bet.
Yeah.
Talk to me about the feedback. So like, how has patient feedback shaped or evolved the business over the last few years?
A lot. I listened to them. You know, everybody likes a pat on the back.
Of course.
Everybody likes a good review.
Of course.
And I felt that the way that I relate and communicate to the patients is what had built the business up until that point. So when I was ready to hire new clinicians, I was really looking at their personality. Of course, their clinical skills had to be there, but you know, hire for personality, right?
Yeah.
They still have to have the degree in our field,
Of
but
course.
the audiologists that I have hired have been either referred to me, usually by somebody else, another provider, and those providers knew me and really felt like those audiologists were a good fit.
And there was somebody that you could trust referring.
Yeah, absolutely.
I've had the same luck, fortune. You know, I've not ever had to, you know, recruit heavily or anything like that. It's all been like word of mouth, or hey, you got to meet this person. Even Jacqueline behind the camera, I just kind of ran into her at an event. Like, I do have a need for your skill set.
See
you
how
know?
you can fit. Yeah.
Right. Yeah. So, but you're right. Hire for character, and they got to be a culture fit first. They have to do the skill. They got to have the skills. But even on that level, some of those skills can be taught.
Some of those skills can be taught. And I just get a lot of great feedback from the patients about how clinically strong they are, but how comfortable they make them feel. And I don't want little mini me's. That's not the goal. But we do have a culture
that you have created.
Right. And that's kind of what they expect. And so somebody who's got just like a really big, loud personality just isn't.
Right.
It's not our vibe.
But it might be the vibe somewhere else. And that's okay.
Absolutely.
And that's okay.
And I probably would love to have that kind of energy, but it's not my energy.
Right. Talk to me about how many team members do you have now?
We have myself, 2 audiologists, an office manager / audiology assistant. She's been with me since almost day one.
Wow.
So she's been with me for almost 8 years now. And then now we have somebody at the front part-time who's been a dear friend of mine for years and was ready to go back to work. So now she's with us.
Very
cool. She's been great. And I need one more.
One more.
I need one more
to this great culture.
Please, one more.
Talk to me about going from, you know, owner operator, business owner, entrepreneur to leader.
That's a hard one.
What's the transition been like for you?
I kind of when I was hiring for the first time, not for the first time because I've had another audiologist, but I always thought it was going to be a partnership.
Yeah.
And then I quickly realized that they were looking to me for leadership.
Yeah, absolutely.
And so really it's only been in the last year that occurred to me that was a need that they had.
Yeah.
So I am trying to develop that side. Am I good at it? I don't know. We're going to stumble and fumble, aren't we?
I think that's okay. Like, I think that the little mistakes here or stumble, fumble are learning opportunities, right? Because they're learning just the same. They're learning to better themselves at their craft, to be a better team member. And we're learning to be better leaders. right? Every day.
And it's such a delicate line between making them feel empowered.
Yeah.
You know, these are grown women with big girl jobs and
Yeah.
big girl degrees.
Of course.
So I want them to feel empowered to make certain decisions, but I want to help to lead them in those decision-making skills.
Yeah. Yeah, it's a fine line, right?
Yeah. It feels like parenting in a way,
well,
without
yeah.
trying to be condescending.
It is. It's very much like that because you want to use the word empower, and that's powerful. Like when they got a big girl job, you said, or a big girl degree, but they want to come to work and feel fulfilled.
Right.
If they're never going to love the business as much as you, right? They're never going to. Agento is my baby. They're never going to love the agency as much as me. It's my baby. But I want them to come to work and enjoy what they're doing as much as I enjoy what I'm doing.
And isn't it fun when they start protecting your business?
Yes, when you see that.
Yeah.
Oh, wow, thank you. Like,
Yeah.
yes, it feels good. And the only way that they're going to do that is if you're pouring into them, right? As a leader. So I had, to transition from operator and truly at my core, I'm an operator. Like I don't often get to like sit and code and stuff anymore, but like when I do, I love it. It's fun. And so I'm still an operator at heart, and I had to learn. I'm still learning.
And how do you learn?
I think by doing.
Okay.
And making mistakes. Now, shouts out, I've got great coaches, Devin Dash, shouts out Devin Dash. Shouts out Mitch Lamazov. I've got great coaches.
That's where I was going.
Yeah.
Yeah. You have to have some sort of leadership for us on how to do that, whether it's through a mastermind group or a good mentor.
Good mentor. Do you have some mentors? Good. Yeah. I didn't get a mentor when I first started and got one a few years into it, and it was monumental.
Huge.
For me.
It's been a huge. To be in a room, I'm part of a mastermind group that is, 30 other practice owners across the U.S., and we get together in person twice a year and virtually twice a year.
Wow.
And our mentor was from our industry, is my digital marketing company.
Okay.
And he's a very energetic, happy person and is really passionate about leadership and mentorship.
Yeah.
And so he's transitioned his degree from digital marketing into leadership.
Very cool.
Yeah.
Very cool.
Yeah.
And so when you said virtually and then twice a year in person, is it all audiologists or is it all clinics?
It's all clinics. So some
okay.
people don't see patients, some people are audiologists, some people are hearing aid specialists.
Gotcha.
But we're all in the industry, we all have clinics.
Gotcha.
Yeah.
Okay. Talk to me about your industry and your practice. So a patient comes in, what are they experiencing, and then how does your practice help them?
They come to us for a variety of reasons, mostly hearing loss. That's the meat and potatoes of our business, is helping people to hear better.
Okay.
So they could be coming to us because they're referred by a physician. They'd be coming to us because they have a family member that's inspiring them.
Yeah. Like this.
Gently encouraging
Yeah.
For them to come in to have their hearing tested. What we recognize and what we're trying to draw out of them at our initial consultation is where are those challenges presenting to themselves in their lives? Because your life is different than my life, and your motivations are different than mine, and your relationships are different than mine.
Yeah.
So it's really important to all of us that we sit and listen more than we talk.
Yeah.
And ask the
2 ears and 1 mouth.
right? And try to ask the right questions so we can understand what their motivation is. If you are, as I call, externally motivated,
okay,
to come in for a hearing test, I need to know that, and I need to know what your goal is. Are you coming in for a baseline test? Are you coming in because you need hearing devices? What's the end goal here? So we try to meet them for where they are.
Got you.
Some people are very nervous about coming in or anxious in a way. They're afraid this is going to cost them a lot of money, that we're going to try to talk them into something that they don't want to do. And we need to have that honest conversation so that we know what direction to take the appointment that is where they want, what their end goal is.
I feel like, thankfully I'm not yet experienced any hearing loss or anything like that, but I feel like if somebody made me feel seen, right?
Right.
If I came in and they asked me questions about what my goals were, not just like sign right here, sit right there,
Right.
I would be more comfortable, and I would give you, because I'm gonna make an assumption here, but in healthcare, I always hear practitioners say like that sometimes the patients don't tell us everything. I feel like if I was put in that situation, I'd spill my guts. Here's why I'm here. Here's what I really want.
Right. And if I look at you and I say, what is your goal? Is your goal to pursue hearing instruments, or is your goal just to get a baseline test? What do you want to get out of the appointment?
Right.
I get a lot of honesty back.
I bet. That's a great approach.
You
I
just
really like that.
because it has to come from a point of genuine concern.
Right.
And you have to be honest with me. I mean, if you've got a barrier up, it makes my job really, really hard.
Yeah. And then you can't truly help if.
Right.
Yeah. Wow. Okay. You mentioned big girl degrees, big girl job. Is it all females?
We do have all women.
Intentionally, or
No, not
Okay.
at all. It's very interesting in our industry. If you look at hearing instrument specialists, it tends to be, I don't know if it is anymore, but it traditionally it's been very male dominated.
Wow, interesting.
When you look at audiology and the doctorate degrees, it's very female dominated.
Really?
Yeah.
That's interesting. I wonder why.
Yeah. But then you go to the business ownership side, and I would say that it's very male dominated, but our mastermind group is mostly women.
So maybe not.
So, we've got a lot of husbands in there.
Yeah, for sure.
And a couple of, several male owners as well, but it just for some reason tends to be really female dominated. So I'm not opposed to having a dude in there.
Right, it's not on.
It just hasn't come across as an opportunity.
Yeah. As a female business owner, did you find that you ran into any struggles that you might not have?
Either it's not on my radar, or the answer is no.
Good. I get a plethora of answers when I ask folks, do you think that this kind of was a struggle you had? Some people say yes, some people say yes, but some people say, I didn't notice it.
I would say, for me, the learning curve was learning to communicate more like a man.
Okay.
I guess is the best way to put it.
Okay.
That I don't have to say, well, no, because I've got this and this and this. I listen to my husband, too many words. That's what he says.
Yeah, that's funny.
So I've learned to say things like, I wish I could, but I can't.
Right, yeah. That's pretty good.
And it doesn't have to be anything behind it. There doesn't have to be an apology for it.
No.
And so back to the leadership part, I'm trying to teach my audiologists this too, both personally and professionally.
Yeah.
It's okay to just say, no, thank you.
Yeah, and that's okay.
And that's okay.
Yeah. Husband, and you mentioned you have 2 teenage boys? Lacrosse, right?
Lacrosse.
So that's full-time job at home and full-time job business owner?
Well, my older son is driving now, so that helps a lot.
That
so a
takes a
14-year-old and a 17-year-old, and they're both at the high school this year.
How do you manage do you believe in this work-life balance thing, and how do you navigate that?
I go back and forth. I believe in it when it's working.
It's not working, then I don't believe in it. Yeah.
We're all, as humans, going to drop a ball.
Yeah.
The whole idea of juggling everything all at once and doing a really good job of it is a fallacy. It's impossible.
No, it's not. It can't be done.
Something is always going to fall by the wayside. So it's either me personally, it's the business, it's the kids, it's the husband.
And it's not that they're not equally, right? Like I love the business and I love my family. They're not, you know what I mean? I don't love one child better than the other, so to speak, right? But yeah, we had a guest on here a while back, Eric Conovallo. He's like a sales trainer.
I've met him.
Great guy, right?
Yes, really great guy.
He said, I don't believe in this work-life balance. I believe that your life goes through seasons.
100%.
And ever since he said that is, I didn't realize that's how I look at it, but it is exactly the way that I'm looking at it. Sometimes I'm in the business 60 hours a week. I'm not home as much, and that sucks. Sometimes I'm home more and I'm in the business 40 hours a week, right? because I'm required, that's the season that I'm in, I'm required to spend a little bit more time here or there because I'm needed in those areas at that.
Yeah, I completely agree.
But the seasons change,
Right.
right? And I don't know that they'll ever stop changing.
No, and you don't want them to, because that's what makes things a little spicy.
It does. It does. And I feel like it because it's so different day to day or season to season, like it keeps me motivated. I know what I'm working for.
There's no seasonality to your business, right? In this area?
No. It's all year round.
Okay.
Yeah. We see, it's funny that you ask. All year round it's busy, but the end of the year, like October, November, gets real busy.
Why do you think that is?
I think that people set goals for revenue. And they're realizing they're not going to hit it.
Right.
So what do I do to change that next year? They're formulating their budgets, things like that. December's out. They're doing family stuff. Same here. We actually close the last 2 weeks of the year, give staff time off. But October and November, the phone just really, really lights up with people who are like, hey, I need help. I don't know how to do this. Which I don't know how to do what they're doing. Right? So we allow them to focus on what they do great, and we'll do what we do great. But outside of that, no seasonality.
Okay.
It's steady busy pretty much all year round in this area.
That's nice.
Yeah, how about you?
Yeah.
A lot of season. Yeah, snowbirds.
A lot of seasonality. This year, what we're dealing with is because the hurricanes were so bad last year. I think people are, and you may have noticed the traffic doesn't seem to be as much.
No.
Are they staying
Just a little
home
bit
longer before coming down here?
I measure season by our healthcare clients, and our healthcare clients have seen season this year for the first, like snowbirds, for the first time, where they went home and they stayed a little bit,
Right.
and then they'll come back, in the
And
winter.
at the beginning of the year, when they were heading back, we had a lot of people say that they weren't coming back this summer,
Right.
or I'm sorry, this fall.
Yeah.
That that last hurricane season was just,
It was brutal.
it was brutal,
Brutal in
and
this
they were selling and staying up north.
Wow, interesting.
So we had a little bit of that at the beginning of the year. This year, I think they're staying up north longer before they come down. And I don't know about you, but I'm holding my breath until September is over.
Yeah, can't blame them. I'm checking the weather report every day,
Right. So I think that there's a little bit of that as well.
I
So
get
we
it.
do get a lot of seasonality.
Gotcha.
Yeah.
We've started this tradition lately where we'll ask a guest what they would ask an entrepreneur. And so there was a guest in your seat an hour ago, and so I'm going to ask you the question that she wanted to ask an entrepreneur, and it was, if you were to lose, or you were going to lose your sight today,
Okay.
what's one thing you would want to see before you lost your sight?
Oh gosh, it's gonna make me cry.
It's tough. I was like, wow.
Yeah, probably my kids.
Yeah, same. Yeah, same. My family.
Ooh, why did they get me?
They give you
Well,
such
that's
a tough
embarrassing.
question. Cover a paper towel. No, it's a great answer. That's I think what I would want to see as well. Yeah, my family. Yeah,
Yeah.
for sure. I told her. I said that's a powerful
husband
question.
too, of course.
Of course, yes. I told her. I said that's a powerful question for anybody, but particularly the next guest who and we don't.
Yeah, tell her I said thank
can't-
you so much.
I
appreciate it.
I'm gonna call her after this. She didn't know who you are or who, I couldn't tell her that. So now I'm gonna ask you the same. There's gonna be another guest in your seat later today, an entrepreneur. If you could ask an entrepreneur one question, business person, doesn't matter, one question, what would you ask them?
So that maybe leads me, and I'm the hearing girl.
Yeah.
So what would you want to hear if you were to start to lose your hearing, and you knew that it was going to get to a point where life was maybe not all the way, but life was going to get really, really difficult for you?
Yeah.
What would be something that you would want to hear or listen to?
Like one last time.
Yeah.
That's a great question.
Yeah.
All right. You guys remember that? You guys want to mark down? I'll ask our next guest. I can't tell you who it is,
Yeah.
but when the episode
All
debuts,
right. I'll
you'll
look
know.
for it.
It'll be the episode that comes out right after yours.
Nice.
Doctor, thank you so much for joining us today. I really
welcome.
appreciate it.
Thank you so
This was
much.
fun.